So I will just give a very short introduction of this topic. Perhaps several of you already heard about this topic. And I can tell you that as Executive Director of IMI, I am extremely proud to launch this call for antimicrobial resistance for a number of reasons. Can I have the first slide, please? The title slide. Thank you. As you all know, antimicrobial resistance is a major public health need. It has been recognized by, for example, WHO as one of the 3 major threats to human health. And as you know, this is probably the best example of a situation where public health needs meet industry needs. We need a partnership there, a public-private partnership, to indeed tackle this disease, which, as you know, can be devastating. You have here examples of a newborn infected by multi-resistant Staphylococcus aureus. And you have also the example of devastating necrotizing fasciitis from the face, which perhaps will necessitate fascial transplantation later on. And you also know that our patients in intensive care units, especially under artificial ventilation, are extremely prone to develop this type of severe, sometimes, as you know, life-threatening infections. And you also know that during the last 10 years or so, there have been very, very little activity inside companies, inside large pharmaceutical companies at least, to really develop new antibiotics to tackle these antibiotic-resistant pathogen, and few of those drugs indeed reached the market. And as I just said, this has been reviewed by several bodies and several authors. Perhaps one of the most interesting articles, one of the most interesting papers on this has been this paper by Laura Piddock on the crisis of no new antibiotics. And if you read this paper, you will see that she indeed indicates that there are several ways to tackle this important public health need, but one of the ways is certainly to implement a public-private partnership. And IMI, as I explained this morning, is there to remove bottleneck in drug development. And in the case of this antimicrobial resistance topic, we have several bottlenecks. We have difficult scientific challenges to meet. We have also a very challenging regulatory environment. And also, and we have to recognize this as such, we have a lack of incentive, including lack of business incentives for companies to develop new antibiotics for a number of reasons. As you know, and it is right to do so, we try to avoid prescription and administration of antibiotics. Usually these drugs are given for a relatively short period of time. And when it comes to antibiotic resistance pathogens, as you know, the cost of the trials in which you include patients without knowing the type of infection they are suffering from, so you have to include a large number of patients, those studies are extremely costly. So there are several bottlenecks. IMI is there to address those bottlenecks. So we all consider, the European Commission and the European Federation of Pharma Companies, that indeed it was perfectly in the scope of IMI to support an ambitious program in this area. This program will consist of several calls for proposals. And in these calls for proposal, you will see that we cover all the activities, from some basic research, drug discovery research, to late-phase clinical trials, with the objective indeed to accelerate commercialization, meaning access to patients of antibiotics. And sometimes, and this is the case for the 6th call for proposal, those antibiotics already underwent part of the development process. They are there, simply the companies were reluctant to move forward to the costly phase 3 trials because of the reason I mentioned. And indeed, we considered that it was in the mission of IMI to promote, to accelerate the development of these drugs through a public-private partnership. And this is the rationale for the clinical trials which are part of this call for proposal. So I will stop this short introduction here. We just thought that it was important to really tell you how we see this program and this call in the overall mission of IMI. And now I will ask David Payne from GlaxoSmithKline to introduce the call as it is, and his presentation will be discussed, and further information will be provided later on by the scientific officers in charge at IMI of this call, namely Nathalie Seigneuret and Maria Teresa de Magistris. David, may I ask you to take the floor?